Dr. Patricia Marthone.
Good evening, everyone. So, how many people know that greater than 30% of the nurses and doctors in the United States are immigrants? How many of you know that about 40% of the home health aid workers are immigrants? If one person raised their hand, could you imagine if some of the policies that we continuously hear coming out continue to progress, where we will be as a society trying to provide health care to everyone that needs it? The Institute of Taxation and Economic Policy in 2022 said 96.7 billion. Do you know what that number is for? $96.7 billion were generated from undocumented tax contributors. So what does that say to us? Well, 60% of that goes to the feds, 40% in New York State, and it was about $3 billion for us here. But of the 60% that went to the Fed, 34% of that went to social insurance programs. Social Security, Medicare, and unemployment. Something that if you are an undocumented taxpayer, you don't even qualify to get. They contributed more to our economy than they can possibly ever cash in. And I'm gonna tell you, they have tax credit restrictions, are less likely to claim a refund, and less use their tax preferred retirement and investment incomes. Why do I say this? Because in that year, they documented 11 million undocumented workers that paid taxes, but they were 3.4% of our population. Guess how many made up our workforce? And I'm not just saying healthcare, the American workforce, 5%. So what happens when we lock them out, drag their kids out of schools, go into hospitals, drag patients out of their beds, pull them out of clinics, not have our lawyers represent unrepresented minors or minors that are alone in this world? What are we doing to our society? I don't know about you, but I cannot sleep at night. I am a Haitian American, and I'm gonna tell you, there is not one person, whether you're from Venezuela, whether you're from another country, that I don't know that's going through a lot of problems right now. Because the thought of them losing the people in their family, or friend, or neighbor, to what's going on, and not really taking into consideration the full picture of what it means to deport people without having a proper process is a problem. So I know a lot of people think, well, they're undocumented. How can it? No, they're somewhat documented. Let's be clear. Maybe all don't have documents at the same time, but by the time they get to a location, they are documented. They were given papers to work. And again, do you know if they remained in our system? If we were to document, and this is for 2022, if we had chosen in that year to document everyone that was in the country, you want to know how much more we would have generated for our economy? $40 billion. And I'm saying this because people love to say they take more than they give, and how wrong are they? And I'm sharing this as a frustrated healthcare worker, as someone who represents healthcare workers. I not only represent clinics, I represent pharmacies, I represent people that are in medical facilities adjacent. They do medical facility adjacent work. They do legal work around a lot of things that are going on in healthcare. None of them deserve to be unemployed, and none of them who are doing the work they're doing, getting paid what they're getting paid, by the way, need to continue doing that work if it's not for their hearts to begin with, knowing that this work must be done. So what they're getting paid for those fundings to be cut off is atrocious and unnecessary. So $11.99, we have 450,000 plus members. We're in 5 states and DC. And our strategies are, one, to prevent institutions from having the issues that they're having, with potentially having deportations right from under the patients from their beds, which is a horrible thought. You go to your doctor, you're being escorted out of the clinic in handcuffs, and they're not being gentle about it. 2, patient advocacy, because if we don't represent them, who will at this point? 3, We believe that our elected should stand up and do the right thing, not jeopardize the people of New York when this was supposed to be a safe haven city, jeopardize our family and friends for deals that they're cutting. We don't believe in that. And 4, we firmly believe that we are going to continue to educate our members and everyone around them to make sure that they know what their legal rights are to push back on ICE. Thank you.